Red Bull gives you wings.
Hey everyone, and welcome back to Nursing for Dummies. I'm Nurse Henderson. Today, we will be covering each step of the nursing process through a community case about Imogene, a 14-year-old teen who experienced many hardships growing up. In this case study, we will have the opportunity to intervene in her life as a community nurse working at a sexual health clinic in Calgary, Alberta, by using the population health promotion model. If you need a refresher about the nursing process, check out my previous video linked above. Today's video will include guest speakers who were the community health nurses directly involved with this case. Now let's get started with some background information about Imogene.
This is Imogene. Imogene and her family lived happy lives. They didn't have everything, but they had enough. From a young age, Imogene excelled in school, but was always more reserved and shy. But one day, everything changed. Imogene's dad passed away from a massive heart attack when she was just 10 years old. It was sudden, and being an already low-income family, this greatly affected their family. Imogene's mother suddenly had to pick up more shifts, so Imogene took on a lot of responsibility to take care of her younger brothers at home. Of course, she couldn't do this alone. Imogene's uncle would come over often to help take care of Imogene and her brothers after school. She was only 11 years old when her uncle first touched her. Imogene knew this seemed wrong, but her uncle would often bring gifts for her and told her she had to keep things a secret. Imogene felt a lot of guilt and knew her mom was already under a lot of stress, so she never told anyone in order to protect her mom and her brothers. Fast forward now to age 14. One Saturday, Imogene and her family were having breakfast and Imogene started feeling nauseous and got sick. Her mom approached her and asked what was wrong. They sat together and had a conversation. That was when her mother realized she skipped her period twice. Her mom was worried about it, so she took Imogene to see a nurse at a sexual clinic. During the assessment, the nurse asked her a few questions about the possibility of pregnancy. Imogene was hesitant but began to reveal what happened to her on the day her uncle sexually abused her. Once the physical assessment and tests have been completed, it was found that Ginny was not pregnant. However, the nurse sees an opportunity to develop a rapport with Ginny and address some of the larger issues that are occurring in her life.
After hearing this information, we will dive into the nursing process, starting with assessment. Here, we will begin with the windshield survey completed in the community of Greenwood where Imogene and her family live. Here are some key highlights. Starting with demographics, the median household income is $54,000, and 25% of households in this community are run by single parents. It should be noted that Greenwood is a small trailer-based community, and most businesses are located in the neighboring community of Bowness. That's the same with schools, health and social services, and transportation services. Lastly, there's no police service or fire station within the community, and there's no streetlights or sidewalks in the community. Now let's move into the key informant interview. Here, it would be a great idea to interview Imogene and her mother, Fiona, so that they can give us more insight into the community and their personal situation. From Imogene's mother, she said she works long days so she's hardly home. Despite this, she has good relationships with her children, but because they don't have enough money to hire a babysitter, she asked their uncle to take care of them so they aren't alone. She noticed a few months ago that Imogene's mood has changed. From Imogene, she reports feeling stressed and puking often because of it. She mentions that her uncle made previous attempts and touched her uncomfortably for years, but she didn't know how to react because she was scared and protecting her brothers. She also didn't know who to reach out to. Imogene also felt like she couldn't talk to her mom because she was hardly at home and embarrassed. She also mentions that at school there is a sex ed program in place, but it wasn't very good. Imogene also mentions that many of her friends are becoming sexually active, and this makes her feel anxious. Regarding Imogene's lack of sexual education at her school, it would be a good idea to include a focus group to gain a better understanding of her situation and the complications affecting the greater school community. In this case, we decided to coordinate a focus group of the teachers who work at Thomas B. Riley School where Imogene attends. The following is a list of the most dominant things that stood out from this interview. Imogene was active and engaged in class at the beginning of the term, but she is no longer. The teachers at Thomas B. Riley School teach a sex ed program but don't feel confident doing it. And lastly, no one in the focus group reported having a student come to them for support about a personal crisis. After hearing all of this assessment data, I'm now going to turn this presentation over to our guest community health nurses here with us today to speak to the rest of the nursing process.
In this case study, I got two SWOT tables, one for the school and community and one for the Imogene. So for the school and community, strength factors were supportive teachers and connection of community. Weakness was the lack of after-school program and sexual health program. Opportunity was willingness to adopt new sexual health and abuse education. Threat was unsafe environment for children. For Imogene, strength factors was good relationship with her mother and siblings. Weaknesses were psychological consequences of sexual trauma and increased number of absences and low grade at school. Opportunity was willingness to learn. Threat was lack of social support. And lastly, the most important steps before we move on is validation. We validated the fact on the table with school, community, and Imogen to make sure that we got the right information.
My job is to make college easier because students have a lot on their.
So let's talk about our interventions for this case study. Our first diagnosis was risk of anxiety and physical emotional detachment caused by trauma related to sexual abuse, evidenced by key informants and focus group interview with teachers. This intervention was tertiary, and our intervention was to help Imogen develop personal coping skills through trauma-informed therapy for sexually abused children. Our overarching goal was to help Imogen overcome trauma from sexual abuse through therapy and creation of social connection. Our short-term goal was improve Imogen's trauma-related symptoms like anxiety and low self-esteem levels with increasing social connection. And our long-term goal was overcome trauma related to sexual abuse.
Based on our overarching goal, we referred Imogen and her family to the Little Warriors organization to address her traumatic experience from sexual abuse. Little Warriors is a charitable organization in Alberta that focuses on treatment, prevention, and advocacy for children who experience sexual abuse. They run an intensive and trauma-informed program called Be Brave Ranch, which runs 4 times a year in 12 days period. Girls aged 13 to 16 are placed in pairs or cohorts to promote social bonding and support. This program also facilitates healing through evidence-informed clinical intervention, such as trauma-focused cognitive behavioral therapy for groups and individuals, in addition to arts-based therapies like music and drama. In between stays, these children work with their therapist and clinical team on an outpatient basis via weekly group teleconferences and working with resources in their community. A study was carried out at Be Brave Ranch on adolescent female survivors of sexual abuse. This study evaluated the psychiatric outcome of these girls after 2 weeks of intensive combination therapy. At the end of the study, the results showed reduction in post-traumatic stress disorders, depression and anxiety, as well as an increase in self-esteem and quality of life. Studies also have shown that group therapy for sexually abused adolescent girls improves their coping strategies, PTSD, encourages positive behaviors, and incites feelings of empowerment. Group therapy is ideal for adolescent girls who are victims of sexual abuse, as it helps with building bonds among peers who face similar problems and better addresses the shame and secrecy that accompany sexual abuse.
The second intervention addresses Imogen's risk for social isolation, high-risk behaviors, and compromised development related to a lack of parental guidance, inadequate parental support, and trauma from childhood sexual abuse, as evidenced by changes in mood, underperformance in school, and her expression of loneliness at home. So this led us to our overarching goal of engaging Imogen in after-school programs, which involves physical activities and social connections. This initiative is beneficial in promoting self-esteem, confidence, safety, and healthy behaviors among at-risk youth like Imogen. This intervention aimed to improve the health and social outcomes of Imogen by providing opportunities for healthy child development, education, and physical environment. Therefore, it reflects a tertiary level of prevention. Imogen's involvement with the program will also include valued benefits for her mother by reducing feelings of stress and worry about her child's safety. Promoting positive emotional outcomes for Imogen's mother is also beneficial in facilitating a supportive environment for Imogen and her siblings. In fact, a secure, stable, and healthy relationship in the home environment is crucial for developing personal skills among youth, which includes self-esteem, confidence, and communication. So, through a self-rated satisfaction survey for Imogen and a structured interview with her school teachers and program coordinators, we aim to achieve improvements in Imogen's knowledge regarding safe and healthy practices, as well as development of personal skills in terms of communication, problem-solving, critical thinking, and interpersonal relations. We also aim to achieve an increase in her confidence and self-esteem. So these outcomes are measured by her instructors through her attendance rate in both her school and the program, as well as by a rough estimate of the times Imogen initiated conversations with her peers or volunteers to lead or participate in activities. In the long term, we are determined to improve Imogene's academic performance by decreasing her tardiness and absence rate by 50% and increasing her overall average grade by 10%. We will gain insight about the impacts of after-school programs on her mother by a self-rated satisfaction survey consisting of indicators such as perceived stress levels, productivity, and quality of relationship with her children. And this will be administered once every 3 months for a year.
Okay, based on our overarching goal for the second intervention, we found that after-school programs benefit Imogen and her two brothers. But unfortunately, their school didn't provide any extracurricular activities at that point, according to the focus group interview. Research showed that youth aged 5 to 14 with no other supervision after school are at increased risk of obesity, academic struggles, isolation, and high-risk behaviors. After discussing this with Imogen and her siblings, we decided to support and advocate for them to participate in an after-school program. We found one program that was close to their school, so we thought it's a great fit for them. This is called Bonus Club. Bonus Club works with children, youth, and families to unearth their potential and support their growth. They also support children and youth to experience new opportunities that develop confidence, encourage positive relationships, and build capacity to deal with life challenges. Their programs vary from day to day and are based on helping children build a positive sense of self. A few examples include Young Olympians, cooking class, drama, music, leadership, and employment programs. They also have a number of programs for families called in-home support and counseling. One study stated after-school program can provide a safe and structured environment for children to spend time in while their parents are at work by reducing the risk of unsupervised time that can lead to behavioral problems such as smoking, drinking alcohol, and using drugs. Another study indicated that many after-school programs improve a child's academic performance and reduce stress on the parent in helping with homework. It also provides opportunities for children to interact with peers and develop social and health literacy skills. Last but not least, after-school programs can provide parents with peace of mind knowing that their child is in a safe and productive environment. Overall, Bonus Club after-school program would bring a wide range of benefits to Imogen, her brothers, and their mom through providing supervision, academic support, and socialization, and reduce stress on Imogen's mom.
To recap, remember that the overarching goal for the first intervention was to help Imogen overcome trauma from sexual abuse through therapy and creation of social connections. Hence, the evaluation was done using evidence-based survey methods, namely adolescent social interaction profile and trauma symptom checklist for children. Results gathered from these surveys show that Imogen found the group very helpful. Through it, she was able to connect with peers, increase and strengthen social connections, thereby improving her self-esteem, confidence, and personal coping skills. For the second intervention, the overarching goal is to engage youths in after-school programs involving physical activities and strengthening social connections, which is beneficial in promoting self-esteem, confidence, safety, and healthy behaviors. Hence, the evaluation was done by comparing the pre and post surveys from Imogen and other key informants. The following results were recorded. For Imogen, she found Bonus Club accessible and welcoming. She actively participated in the program activities, began to initiate more conversations with peers, and was more likely to volunteer in leading team activities. The teachers at Imogen's school and after-school program confirmed that Imogen had increased social connections. Imogen showed increased self-esteem and confidence in leadership and social engagement. Imogen had increased school participation and was more engaged. Lastly, the community health nurses followed up with Imogen's mom, and she reported that ever since Imogen got involved with the after-school program, she has peace of mind regarding her child's safety. Her family relationship is strengthened, and she has more time to be productive. This evaluation provides evidence that our intervention addressed family as a level of action. And to our greatest surprise, the provincial government adopted this idea and is developing more child-centered after-school programs in the cities.
For thin, natural feeling, Trojan Bearskin, get yours on.
From our assessment, we found there was a risk for sexual abuse perpetration and negative sexual behaviors among the community related to low socioeconomic status, inadequate sexual education, and inadequate teacher knowledge on how to respond to abuse. Sex education in schools often uses scare tactics, is awkward, and overall just not very helpful, which can undermine high-risk groups especially, such as those from low socioeconomic communities, where there are often more questions about initiation, contraception, and pain. Teachers also tend to be reluctant to help students experiencing abuse because they fear potential negative consequences, or because they feel incompetent addressing these issues entirely. We worked with the Thomas B. Riley School community to address education as a determinant of health, where our overarching goal was to strengthen community action against sexual abuse. Starting with our short-term outcomes, we wanted our students to have improved health literacy by increasing their knowledge of sexual and reproductive health and their own rights and responsibilities. To do so, teachers need to deliver adequate sexual education using high-quality teaching materials and have increased knowledge on recognizing, responding, and reporting student sexual abuse. For our long-term outcomes, we wanted both teachers and students to be confident in the quality of sexual education that was provided at their school. For students, we want them to make informed decisions regarding their sexual health, decrease high-risk or inappropriate behaviors, and feel more comfortable to come forward about potential abuse to their social support networks. For teachers, we want them to have a greater sense of civic duty in reporting sexual abuse, be confident in their ability to support students experiencing this type of abuse, and have more confidence in navigating reporting procedures and referring students to adequate resources. We facilitated a professional development seminar which educated teachers on legislation such as the Child, Youth, and Family Enhancement Act. This states if there is reasonable suspicion of abuse, all school personnel are required to report it by law. As a form of tertiary prevention, we also provided teachers with training to increase their knowledge on how to recognize and report abuse within their classrooms, which decreased fear or reluctance from doing so. We also helped to implement an improved sex ed curriculum developed by the Advocates for Youth organization, which helps to prepare educators to provide consistent, high-quality sex education that young people deserve. Advocates for Youth roots their curriculum on the 3 R's, that is, rights, respect, and responsibility, and provides teachers with PowerPoints, guides, and lessons plans that can be filtered by grade, topic, and language. It also offers family homework activities that students can bring home and work through with their parents. This was a method of primary prevention, as adequate sexual education promotes health literacy so students can make informed decisions and avoid negative sexual behaviors. Giving high-quality sexual education also utilized tertiary prevention by enabling them to better identify when sexual abuse or harassment happens to themselves or their peers. Overall, these activities strengthen community action by promoting a united front against sexual abuse within the Thomas B. Riley School community. To evaluate whether we met both our short and long-term outcomes, the teacher reporting attitude scale for child sexual abuse was filled out by teachers before and 6 months and 1 year after the seminar. This validated survey measured things like knowledge, duty, and attitudes about reporting child sexual abuse. We also gave students a similar survey to measure their knowledge and attitudes towards their own sexual literacy, and this was distributed before and after they were taught the Advocate for Youth curriculum by their teachers. Student knowledge was also inferred from their performance on quizzes integrated within the Advocates for Youth modules.
Thank you to our guest speakers who truly make such great differences in people's lives. Following intervention, implementation, and evaluation, let's look at how Imogene is doing now. Imogene got her life back on track after learning great personal health practices and coping skills from trauma counseling at Be Brave Ranch and sexual education from Advocates for Youth at school, and plus the after-school program at the Boys and Girls Calgary Club. She finished school with great grades and her family dynamic improved immensely. The help she received from the community nurses inspired her to pursue a nursing career herself, where she could give back to families in need just like her. In other words, I'm doing great. I am Imogene. Once again, thank you to our guest nurses for today, and thank you all so much for watching. Don't forget to subscribe, put on your notifications, and give this video a thumbs up. Also, shout out to Caffeine Crashers for supporting and sponsoring this video, and I'll see you all next time.